Hey everybody, Dennis with Respiratory Sensei. Finally, we're on Egan Chapter 9, and finally it's about something that we care about. It's about anatomy and physiology. Let me also tell you that this chapter is going to require several parts because there is a lot we have to cover, and we can't do that just in 2-minute short. Okay, back to the alveoli. When a fetus develops in the womb, the alveoli are these tiny little sacs that gradually get softer and softer and stretchier. However, if an infant is born prematurely, then their alveoli are not soft. In fact, the tissue is supposed to be very soft and spongy and very stretchable. But if they're born premature, then that tissue is not soft and spongy. It's really kind of hard and crunchy. Crunchy is probably the wrong word there, but anyway, it doesn't stretch very well. And so we want it to be soft and pliable. Well, it turns out we have this very magic agent called surfactant. It directly affects them. And the way we do it is we instill this surfactant down through the ET tube, or basically down into the patient's airway, the little baby's airway after they're born. And we try to get it to literally touch alveoli. What happens is this little alveoli sitting here, it's kind of hard and crunchy, I call it. And then a little drop of surfactant comes in, and it literally, on contact, almost just kind of melts the difficult part of the spongy alveoli, makes it totally soft, spongy, and stretchable right away, right now, on contact. And so literally, if you have a baby that was born premature, and they're kind of difficult to tell, they're kind of difficult to ventilate, I should say, then what you can do is instill surfactant, and upon contact, usually within 15 minutes to about an hour, and sometimes multiple doses of surfactant, you can totally change the baby. They can go from having respiratory distress to breathing kind of normally. So what surfactant is doing is actually maturing a premature lung. And in that way, it's kind of miraculous. Okay, you need to know about surfactant. You can definitely use that in the real world if you're going to be dealing with babies, and there are some questions on the NBRC exam about that. I'm Dennis with Respiratory Sensei. If you've missed some of these videos in the past, be sure to subscribe and get some of the old ones, and then subscribe so you don't miss any new ones.